Chair, recognize the gentleman from Virginia, Mr. Griffith. 5 minutes for questions, please.
Thank you, Mr. Chairman. Let me just say I appreciate your report. I appreciate the fact that the FDA, Dr. Gottlieb, earlier today said he's going to take a number of those recommendations, and they're announcing some steps that may improve the process. We've already heard from other witnesses or from other members of Congress who've asked you about the concerns of manufacturers, and I think you've covered that, which was where some of my questions were going to go. Let me ask a little bit of a follow-up in a slightly different direction. Does the FDA also require that safety data include the reporting and use of data on patients that benefited from the expanded access treatment? So previously we've talked about all the concerns about manufacturers about the adverse. Does the FDA use the things that turned out well, and how did manufacturers, if so, and how did manufacturers respond to that?
Right. There are requirements, and this is, as you've acknowledged, on safety reporting. I think we heard from FDA that there were circumstances when they saw other information, such as dosage or other information that might be useful and that could prove it, and that there were limited instances, it's also limited here, where the information could be used by the manufacturer in supporting its application for approval. And so in those cases, if the manufacturer is providing information to FDA, in some limited cases, it's also helped support FDA's decision for approval or labeling or dosing.
Well, I do think that it's important that FDA consider both, because it may not be the best evidence. We might want to have the full clinical trial to get the best evidence, but when you have somebody who is using this process, it is at least some evidence of whether it's good or bad or helpful or not helpful, and I do appreciate it. With that, Mr. Chairman, I yield back.
Chair thanks the gentleman. Gentleman yields back. And Mr. Dick, let me just ask you, you heard Commissioner Gottlieb, Dr. Gottlieb, and